What is the primary purpose of using open-ended questions when communicating with patients? So just to review, open-ended as opposed to closed-ended questions. So if we think of the difference, open means that you're keeping the door wide for any type of response from a patient, as opposed to closed-ended means it's very narrow and you're going to get only specific types of replies. So for example, if you have your open-ended versus your closed-ended. So if you have a closed-ended question, you're going to get a very specific answer. So maybe an example for that would be, did you go to school today? Yes or no? How many times do you exercise a week? 3 to 4 times. But if you have an open-ended question, then you are going to get a broader answer because it's not limited to just a number, a quantity, or a yes or a no. It would be more like, how was it for you when you went to school today? Or what did you think of your experience here? So you were trying to get a more broad answer, and the reason for that is so you're not kind of cornering the patient into just a specific type of answer. You're getting a more honest, open answer to get more information from the patient. So we will keep this in mind when we look at the choices to this question. So option A says, to obtain specific yes or no answers, and the yes or no would be associated with your closed-ended answers. So you're not getting a broad answer, you're getting a very specific part of an answer. So we'll eliminate option A because that's not what open-ended is. Option B says to limit the patient's input in the conversation, and it would actually be opposite. We don't want to limit, we want to encourage more conversation from the patient and find out more information. So we want to use open-ended for that. That would be to increase, not to limit. So we'll eliminate option B. Option C says to speed up the conversation. And actually, this might make it go a little slower, which would be better because we want to find out more information. We want to have a more enriched experience with the patient to find out more about them. So we will eliminate option C. And then option D here says to encourage detailed responses and discussions. And that makes sense. We want detailed responses and discussions for an open-ended question so we get more information. We're not limiting the patient to just a quantity, just a yes or no. We're getting a broader answer choice here, which is why option D would be the answer to this question.